So, you probably heard of the letters ECT. What are we talking about? Electroconvulsive therapy. Well, it's a very old treatment. Actually, this treatment existed even before medications existed, and it used it's a machine that works like to reset the brain. You probably have had the experience in real life or in movies, things like that, or people that get defibrillated. They have their heart stops, they drop to the ground, and someone comes right away and puts the paddles here on the chest and on the side, and boom, they go like that. They're resetting the heart. Well, the brain, being as such an important organ, just like the heart is, well, we have a machine to reset the brain. And the way it works is with electricity that goes through some electrodes that are put on both sides of the head, or two on one side of the head, either the right side or the left side. And the brain gets electric current delivered. The goal of the treatment is to create the brain to have a seizure or a convulsion. That's why it's called electroconvulsive therapy. And the seizure lasts between 50 and 60 seconds. And then after the treatment, you are relaxed in a recovery room for you to wake up, because this is done under sedation. Ooh, sounds like a horrible treatment. Well, it's not. It actually is a treatment that can save lives. Unfortunately, we don't have it here in Imperial County, but if necessary, we can refer you or connect you with hospitals that do that treatment. So, who are the people that should take this treatment? For example, people with very severe depression that has not responded to anything else. People who have depression with psychotic features, meaning that they have lost contact with reality. People with untreatable mania. That's a very rare condition, but it's one of the components of bipolar disorder. When you go on the euphoric side, you can get psychotic, lose touch with reality, and you're at a very high risk of harming yourself or actually dying. And another one is something called catatonia that I'll be speaking about in the future. So please, when people say ECT, don't be afraid. ECT is a safe treatment, has been proven for almost 100 years now. It's safe, it continues to exist. Before getting the treatment, of course, you have to agree to treatment, and two doctors have to agree that you're a good candidate for treatment, and then be able to get the benefits of ECT. Thank you for listening to another tip on mental health from Sun Valley Behavioral.